Hi, my name is Dr. Alexa Parker. Welcome to my video on how I treat irritable bowel syndrome, colitis, and Crohn's disease using a functional nutritional approach as well as a functional neurological approach. My qualifications are I'm a doctor of chiropractic. I've been a chiropractor for 11 years now. I'm currently enrolled in postgraduate training through the Carrick Institute of Graduate Studies, utilizing functional neurology. I've also studied functional blood chemistry, functional neurotransmitters, and functional endocrinology through Apex Energetics, as well as Dr. Datiz Karazian. I've studied under Dr. Michael Johnson, who is the author of the book, What Do You Do When Medications Don't Work? As well as studied, as I mentioned, with Apex Energetics, utilizing biomedical and nutritional products to correct the treatment of chronic conditions. Great. So today I'm going to be mainly talking about Crohn's disease, irritable bowel syndrome. However, what you'll recognize in actually looking at these list of conditions, many of you may also suffer from several of these other conditions, typically type 1 diabetes, celiac disease, insulin resistance, thyroid conditions, and fibromyalgia, as well as focus problems. What you'll find out today after watching this video is that a lot of these chronic conditions are connected and they have common threads. And if you have one of those diseases, you may have several of those as well. So if we look at the causes of these conditions, many of the causes are similar. If we look at anemias, almost every one out of 3 women actually have anemia. Thyroid dysfunction, unstable blood sugar, okay? So whether you're hypoglycemic or insulin resistant, adrenal gland dysfunction, hormonal imbalances, autoimmune attacks, which you may not know that you have, hidden infections in the gut or viral infections, and I'm going to talk about how I test for those things. Food sensitivities, even if you don't have celiac disease, you can still be sensitive to wheat, dairy, as well as soy products. So we'll discuss the test that I use for that. Hypoxia or low oxygen, chronic inflammation. So for example, looking at homocysteine and C-reactive proteins, looking at the level of inflammation in your system. Also neurological imbalances. So we can have decreased frequency of firing of the brain, which can manifest as brain fatigue. And you'll find out today that if we have damage to the gut, we're definitely going to have damage to the brain. Okay, so normal metabolism is that you eat a food and you digest it properly. Then you use that fuel for energy, okay? How many of you eat food but then crave sugar after you eat? Or how many of you have shaky and jittery episodes between your meals? These are signs of of blood sugar regulation problems from a functional standpoint. So normal metabolism is if you eat it, you digest it properly, and you produce energy from that, okay? So I have a question for you today. 30% of our energy goes to what system? What system do you think utilizes the most energy? Do you think it's the endocrine system, the digestive system, the nervous system, the immune system, or the cardiovascular system? Well, many of you will say that it's the digestive system. However, it's actually the nervous system. So if we do not get enough fuel from our food that we eat, from proper metabolism, or if we have some imbalances such as adrenal, blood sugar, gut infections, that type of thing, we can't get enough fuel from our food, and it actually affects the brain. So the nervous system is compromised. 30% of our energy is used for brain. So how many of you actually have problems focusing or depression? That's because you're not able to get the proper fuel from your food because you have this inflammatory process going on. The nervous system, so it's the nervous system, the brain, spinal cord, and nerves. We need a proper functioning gut for good metabolism, for a well-functioning brain. So we have proper gut function will allow for proper brain function. So the gut-brain connection, let's discuss that. The father of medicine, who was Hippocrates, said, look to the gut. There you will find the origin of almost all of human illnesses. That's because if we have problems in the gut, it will affect our brain and our whole body function, okay? So gut inflammation typically can be from an immune reaction to foods that we eat, food sensitivities such as wheat, gluten, soy, egg, or yeast. Or we can have gut infections such as parasites, bacterial infections that are undetected because generally they're not tested for appropriately. And what happens is when there's inflammation because of that your body, your immune system produces cytokines. They're called inflammatory cytokines. So it's an immune reaction. What happens is those inflammatory cytokines cause damage to the gut lining, which is leaky gut. And over time, the gut becomes less permeable and it starts to leak food or proteins out of your gut, which can cause more food sensitivities, but also it can cause inflammation in the body, joint pain, muscle pain, brain fog, right? Also what happens is these inflammatory cytokines cross the blood-brain barrier. They go into the bloodstream, then they cross the blood-brain barrier. When they cross the blood-brain barrier, we have different immune cells in our brain, around our brain, that are called microglial cells. So they're activated and they start causing an immune response. So we get brain fog, fatigue, depression, that type of thing. So this causes inflammation in the brain. So we know that if we have inflammation in the gut or fire in the gut, we're going to have fire in the brain. 70 to 80% of your immune system is in your gut or your GI system. Therefore, anything that causes an immune reaction in your gut will trigger inflammation, okay? So if you're eating foods all the time that you're sensitive to, if you are exposed to an infection at a low grade, like a functional infection, for example, bacterial, parasites, mold, fungus, yeast, overgrowth, viruses, all of which may not have been detected in your blood work, what happens is you're constantly waging a battle against your immune system. And so your body doesn't have the ability to continue to fight it off, okay? So we get chronic pain, chronic fatigue, all of those things. So this immune challenge in your gut mobilizes your immune system, which are the cytokines, which then cross into the blood-brain barrier and cause your microglial cells to get inflamed. So we have an inflamed brain. How many of you have seen commercials of people, for depression, medications for depression on TV? What do you think is the leading prescribed medication in our country? Generally antidepressants, right? Well, if we have poor gut health, we're going to have poor brain health, okay? So we've got to correct the cause in order to correct the brain and alleviate those symptoms. Did you know that 90% of the brain cells are immune cells? They're called microglial cells. So when we have fire in the brain, we have a major reaction, which causes a lot of problems, focus problems, concentration problems, depression, fatigue, all of those we see, and we call that brain fatigue. And generally we find that people, if they drive for a long period of time or if they read for a long period of time, they get really fatigued and tired. That's a sign of brain fatigue. Or they can't complete a whole lot of tasks throughout the day. They have very little ability or decreased ability to do things they like. So activating those microglial cells causes brain inflammation. So the big picture, if we talk about IBS versus Crohn's disease, both cause similar gut symptoms, both cause similar symptoms throughout the body as well, but the cause of each are very different. If we talk about IBS, the common symptoms of that are abdominal pain, fullness, gas, bloating, acid reflux. We have IBS-C, which is IBS with constipation, versus IBS-D, which is IBS with diarrhea. Or you can fluctuate, which is IBS-A, which is a combination of both. Symptoms can come and go. Generally, people have relief after a bowel movement, but 1 in 6 of people actually, one of 6 people in our country have this condition. This is the most common cause for a visit to the gastroenterologist. This is a condition diagnosed by exclusion, which means that after if they do a colonoscopy or an examination, if there's nothing else, for example, if there's no damage to the gut, if there's no inflammation, if there's no, ulceration in there, generally they will give you the diagnosis of irritable bowel syndrome. Okay, so they generally don't find pathology or disease on the testing. So they generally just, it's ruled out. Everything is ruled out, so they give you the diagnosis irritable bowel syndrome. Other symptoms of IBS. 60% of irritable bowel syndrome sufferers have psychosocial disorders like depression and anxiety. Mainly because this problem can be really embarrassing for people that suffer from it. It can affect their ability to socialize and do the things that they like, as well as they have higher incidences of headaches, fibromyalgia, which is a generalized pain and inflammation throughout the body, as well as chronic fatigue syndrome. Now, if you understand now that inflammation in the gut can affect the brain, you can really see how we can have this whole triad of inflammation, pain, and depression, right? It's the gut-brain connection. The common medical treatment for IBS are anticholinergic medications, so dicyclamine, propanthyline, those medications that start slowing down the sympathetic nervous system. We're going to talk about how that sympathetic nervous system comes into play and how we need to actually address that component to really heal your condition, entirely. Also, loperamide for diarrhea, tricyclic antidepressants for pain and depression, as well as medication for constipation. Again, these medications are really treating the symptoms but not the cause. So if we talk about the medical approach to this, we're really going after each individual symptom, giving a medication for each individual problem, but not really addressing the whole fundamental cause of the issue. And that's what we do in my clinic, is actually work on correcting the cause, getting to the root of the cause and fixing it. Causes of IBS, they're linked to gut infections, whether they're bacterial, fungal, yeast, parasitic, and viral. I use really unique testing that basically will test the DNA of the specific bacterial infection, that bacterial or yeast infection or viral infection that's causing it, often which many are missed on traditional medical testing. I've seen many patients that have had multiple infections, which are taxing their immune system and causing pain. Abnormalities between the gut flora or the gut immune system could also be a causative factor. Overactive sympathetic nervous system. The sympathetic nervous system is a part of the brain that responds when we have an emergency. So it's called fight or flight. If we have some kind of emergency, we have a sympathetic response, which shuts down our gut function. Okay, so this can be a brain imbalance, and we'll want to really look at that specific area of the nervous system in order to really affect the way the brain is firing. Okay, the brain works basically when we have a sensory input on one side of the body. So if someone touches us on the right side, your body sends a signal to your cerebellum on the left side. The cerebellum will then send input into the upper brain, into the brain, the cerebrum, as well as the frontal lobe. Okay, that frontal lobe functioning allows us to actually have proper digestion as well. So when we have a problem in that area, the front of our frontal lobe, particularly the right side, can't stop that sympathetic response. Therefore, our body is constantly in fight or flight. So we're going to want to break that issue or that component and really calm down the sympathetic nervous system so that your body can start producing its own enzymes and help to break down your food as well as dampen your immune system. An overfiring sympathetic nervous system can cause chronic pain and chronic fatigue, irritable bowel syndrome, urinary tract infections, fibromyalgia, migraine or tension headaches, poor posture, and overactive adrenal gland stimulation. It can also cause increased sweating, difficulty of falling or staying asleep, insomnia, because what happens is our body produces certain catecholamines so that it prevents us from sleeping, and we're always in the state of stress or tension. We have increased heart rate, increased blood pressure, cold hands or feet, sensitivity to light and sound. In this hyper aware or hyper stress state, you can't properly absorb foods, you can't properly break down your foods, you can't relax, and you can't heal. So we have to start working on dampening that sympathetic response, not only by healing the gut and working on that, but also working on the brain. Okay. Upper brain fatigue can cause depression, anxiety, as I mentioned, difficulty reading or comprehending things that we read, difficulty driving or fatiguing when we're driving, lack of focus, and this can all be started from the gut as well, fire in the gut affecting the brain. Okay. How did this whole problem occur with irritable bowel syndrome or Crohn's disease? It occurred because of chemical stresses, whether it's foods that you're eating, things that you've been exposed to that you shouldn't, or foods that you're eating that you don't know that you're sensitive to, or that you've developed a sensitivity to. Physical stress, such as car accidents, falls, injuries can affect that as well as a lot of pain and inflammation. Emotional stress can cause damage to the brain as well. So over time, these stresses start to cause damage and destruction of our body. Chemical or physical stresses to the brain, if we talk about those, if we have things like an anemia, if we have functional blood sugar problems, food sensitivities such as gluten, casein, soy protein problems, immune system imbalances such as an autoimmune disorder, poor diet, inflammation, if we eat too many omega-6s versus omega-3s. Omega-3s are the real anti-inflammatory foods that we're supposed to eat. Things like, wild salmon, walnuts, nuts, things that really provide a lot of good fats for us, versus omega-6, which is in the majority of the foods that are produced in America. Hypothyroid function, prescription or non-prescription drugs that can cause chemical stress. Chronic inflammation and hidden gut infections, okay? Emotional stressors, as I mentioned, can affect our adrenal glands, which can also act on our blood sugar and on our hormones. Metabolic disorders such as anemias, blood sugar imbalances, food sensitivities, inflammation. How do you know if you have any of these, okay? How we know is we do proper testing. And what I find is that many of you, many patients that I see are generally, the labs that they have done are generally not thorough enough if they're done by their primary or by their medical doctor. They're not thorough enough to really look at the body as a whole system. How is the immune system functioning? How's the blood sugar functioning? How's the liver detoxifying? Is it able to detoxify? Do you have a possible bacterial or gut infection? In order to determine that, we have to do a fairly thorough blood workup as well as other tests. Now, the other issue is if you do have a blood test that's thorough enough, oftentimes you will get the blood work back, and the blood work will say, according to the lab, that it's normal. Well, what I actually use are actually much narrower functional ranges, and these are the physiological ranges that someone should be in order to be a healthy, high-functioning individual, okay? For example, if we look at the lab ranges on a traditional lab for blood sugar, glucose, its range is between 65 and 110, okay? However, the functional range is between 85 and 100. So if someone has a range of 73 for glucose on their blood panel, we know that they actually are hypoglycemic. So functionally, they're hypoglycemic. They haven't gotten to the point where they're actually sick or pathological enough in order to be diagnosed as hypoglycemic. However, they have this functional hypoglycemia, which is taxing their body and taxing their body constantly. The same thing with TSH, which is the thyroid stimulating hormone. That should be between 1.8 and 3.0. Traditional lab ranges are 0.3 to 5.7, okay? I can't tell you how many people I have seen that have actually found a hypothyroid condition, a functional hypothyroid condition. So we know that a lot of these issues are being missed. And if you have irritable bowel syndrome or Crohn's disease, we need to make sure these other markers are really healthy too, because they're going to have an effect on how you feel and how you function. Okay, so I do a complete blood chemistry panel. I look at all those things: hemoglobin A1C, lipids, CBC. I look for anemias, infections. I look at the thyroid. I look for autoimmune aspects of this condition. I also do salivary hormone testing for the adrenal glands to look at cortisol. So how are you responding to stress? Are you producing too much cortisol or too little? In which case we know there can be damage to the gut lining and the brain barrier system. So we want to look at that. And also it can affect your hormones. We do a DNA stool ecology profile. This lab that I use actually tests for the DNA of these pathogens. So it checks for the DNA of things like H. pylori and these different infections that can be subgrade and often missed. As I mentioned, via blood, we need to look at the gut and really rule out these infections, because the person can't get better unless we get rid of those. I also use Cyrex lab testing, which is cutting edge testing for food sensitivity, which tests for 12 to 15 different types of gluten, the gluten molecule, because we know that there's not just one of them, which is generally tested for, which often can be a false positive. So we look for antibodies to certain foods that we're eating. We look at whether or not you have leaky gut syndrome, so we can actually work on healing the gut. Also look at autoimmunity. Do you have certain genes that really predispose you to gluten sensitivity, or because you have this autoimmune cascade taking place, are you starting to produce antibodies against your thyroid, your pancreas, your brain, all of those things, because we need to fix the cause that's driving that immune reaction, if you do have an autoimmune reaction. Functional medicine metabolic treatments, that would be based on our lab findings, we use nutritional products to correct the biochemical pathways. We work on correcting the gut, the thyroid, the adrenals, the liver, the biliary system, anemias, sugar regulation, and autoimmune regulation. Start dampening that autoimmune response so that you can heal. If there is a brain imbalance, we also need to address that. Some of the ways that we can actually affect your brain is making sure, first of all, that you have proper fuel, that you're getting proper, good glucose, that your blood sugar regulation is good, that you have enough oxygen, that your tissues are oxygenated. So we actually use oxygen as well as exercises to start specific exercises to actually correct those pathways in your brain. So we may use things like exercise with oxygen, we may use vibration therapy, we may use interactive metronome work, we may use eye exercises, things to stimulate your brain using your senses to help dampen that sympathetic response so that we can get the gut healing. Okay? Good. Okay. Crohn's disease, let's discuss that. Crohn's disease is an inflammatory bowel disease. The other is ulcerative colitis. Both are autoimmune based. Okay? They can cause ulcerations, scar tissue, fistulas from the mouth to the anus. There's a higher incidence of this among smokers, and it is an autoimmune disorder. The diagnosis is generally made from a colonoscopy or a biopsy. And with this type of condition, there are exacerbations and remissions, so it can get better and it can get worse at times based on this whole autoimmune cascade. If your immune system is ramped up certain times, you'll have more symptoms. And their symptoms can be similar to IBS, except we can also see we can see heightened inflammation in the area of the joints and the tendons. We can have inflammation of the internal eye. We can have skin nodules and ulcers, blood clots, anemias because of the internal bleeding, peripheral neuropathy, so neuralgias and inflammation in the body, headaches, as well as depression. As far as inflammation in the joints, that tells us that if you have one of these conditions, you can actually have you can create another condition if it's not corrected. It can start attacking your joints. It can start attacking your muscles, attacking your brain. So this autoimmune disorder can continue to start cascading against other tissues unless we really get to the cause or the multiple causes of it and start correcting it from a functional standpoint. So Crohn's is an autoimmune disorder, as is ulcerative colitis. Your immune system is mistakenly attacking your body. And we know that if you have this, you have a tendency to develop Hashimoto's thyroiditis, which is an autoimmune attack against your thyroid, Graves' disease, which is a hyperthyroid state, lupus, which is an autoimmune attack against your soft tissue or your connective tissue. Rheumatoid arthritis is an autoimmune condition which attacks your joints. And pernicious anemia, which is an autoimmune condition against your intrinsic factor in your stomach. One out of 5 people are autoimmune in our country. Most don't know it. And so many of you, so we really need to rule that out. And so that way it doesn't create another autoimmune disorder and we can really correct it functionally. Okay? Medical treatment for this autoimmune, or any autoimmune condition for that matter, is generally steroids. So prednisone, corticosteroids, is also possibly surgery or removal of the affected part of the bowel. Okay? So we're really dampening the immune system. We're damaging the immune system. We're calming it down. We're not correcting it. We're just dampening the response. Okay, that's the medical approach. Natural metabolic approach of Crohn's disease is to remove the trigger to the immune system, help modulate or balance the immune system, and correct the damaging effects of the gut and brain from Crohn's disease, if present, and really work on the gut-brain connection. Okay. Common triggers to autoimmunity are food intolerances, gluten, casein, soy. Those are the big ones, but we also have eggs as well. Smoking, hidden infections, as I mentioned, unstable blood sugar, getting too many inflammatory fats in your diet versus omega-3 fats, stressed adrenal glands, and hormone imbalances. How do you know if you have these? The way that you know is if we test. So we do a complete metabolic workup. We do an adrenal stress index, as I mentioned. We do the stool ecology profile. And we also would do things like checking for leaky gut syndrome and antibodies to food delayed and and antibodies to food, delayed sensitivities. How do you modulate the immune system if the immune system is overacting? We use things like high-grade vitamin D, nitric oxide, glutathione, which helps dampen your immune response, phosphatidylserine, which is important for adrenal regulation, omega-3 fatty acids, as well as other ones that are designed specifically to correct these pathways and dampen your immune system from overreacting. But we do it based on your specific labs, not as a general approach to throwing supplements at a condition. We want to get to the cause of it and really fix your specific problem. Things like RepairVite, things to help repair the gut as well. Digestive enzymes, possibly probiotics. Again, we've got to test first to determine what is actually taking place with you. Neurological consequences to Crohn's, irritable bowel syndrome, and ulcerative colitis. They can be corrected by proper functional neurological treatment and brain-based therapies in order to work on the weak areas of the brain. So what makes our office different from every other doctor that you've seen? Well, I can tell you that we treat people neurologically and metabolically. I leave no stone unturned in order to get to the cause or multiple causes of your condition and then work on correcting it. Okay. So, if you're watching this video, in order to come in to see me and to see if this is something that I can help you with, or if you have a condition that I can help you with, the first thing to do is to call our office or go online and fill out the paperwork. We're going to have you fill out the paperwork and submit that to us and schedule for a complete neurological evaluation. Also, bring any blood work or testing that you've had done with you, or send it to our office beforehand. Your significant other must attend that examination with you so that they can really support you in this process. Also, so we'll do a thorough examination, and then on the second visit when you return, I will go over with you what I found, what lab test I want to run on you, as well as the results of your neurological evaluation. I'll also review with you any financial obligation for your care plan. And again, your spouse or significant other must attend with you. Okay? My special offer that I'm offering to you today is to have 2 of these visits for only $79. Okay? So that allows you to come in, consult with me, have a thorough evaluation, and then go over my recommendations for only $79. Normally, these 2 visits cost $450. I would really encourage you to take advantage of this offer. I only accept 5 IBS or Crohn's patients per month because it does require a lot of energy and a lot of work on my part. Therefore, if you are interested, call our office today and we can schedule you for that evaluation. I have 3 rules, however, for the acceptance of my cases. You must be willing to make serious life changes, okay? You also must be able to take accountability for your health, okay? So if I recommend a specific nutritional approach, you have to follow that. Otherwise, you're not going to get the results that we're looking for, okay? Also, insurance and also Medicare only pays a small portion of this care. However, we have made our care plans affordable so that 96% of the people who see us can get the care they need for as little as $150 to $300 per month, and that's for 12 to 18 months generally. I will tell you that in general, there is an out-of-pocket expense for this. You're going to have to pay out of pocket for this type of treatment. This is highly specialized treatment, and it's something that you're not going to receive in the traditional medical standpoint. Insurance, however, also doesn't cover highly specialized care. So unfortunately, you will have to come out of your pocket for this treatment. However, you will get the results. On a scale of 1 to 10, how serious is your illness to you? How has it affected your relationships, your work, your ability to enjoy your life? On a scale of 1 to 10, how serious are you about eliminating your illness? If you are a 7 or above on a commitment level, I would urge you to call today and schedule an appointment. I only want to help those that really want to get better, okay? Because I know that the nutritional approach that I take is going to require some work on your part. So please call if you are a 7 or above. If you're not at that point yet, that's okay. You're welcome to contact me in the future. But the ones that are truly committed, please call our office today because I'm ready to help you change your life.